So it's been a while since we talked. I think we talked last year around this time, maybe this summer. But welcome back, Dr. Lucius Pomerantz. For the people who missed the first episode, I will put a link to it in the show notes. And that's always going to be winsblog.com/, and then the number of the episode, which you can see wherever you're listening or watching to this. Dr. Luke is a board certified orthopedic surgeon. However, he is also a former MMA fighter, BJJ black belt. So he kind of knows both how to do it and how to heal people. And that's going to be a big part of the conversation now. How are you doing, Dr. Luke?
I'm doing well. It's an honor to be back, Wim. Thank you for having
Uh,
me.
well, I'm very happy to have you here. I always try to have experts on as much as possible. You've noticed this too on Instagram, and particularly, I'm not on TikTok, but I've seen a lot of it on Instagram. Just you see these crazy videos of people doing this insane training in MMA, in BJJ, and so on. I mean, I think the last one you commented on that I shared was the classic, the student has to keep his hands behind his back or whatever, and the coach is just hitting him in the head with, even with boxing gloves, but still, I mean, pretty hard. They're not gentle taps. It's just basically beating the crap out of his student. So, could you kindly explain, maybe once and for all, for everybody involved, why this is such a horrible idea?
Yes, I can. So the biggest problem is that brain trauma is cumulative and it's not something your brain can adapt to or gets better at dealing with. In fact, if you think of it as kind of every shot to the head is taking the capacity of your brain to take on trauma, it takes it away a little bit every time. Um, we see fighters all the time lose their chin, and it's just there comes a point where the brain can't take anymore. And unnecessarily taking shots to the head, one, I mean, no one should be wanting to take shots to the head, but two, it's not making your brain tougher. It's not making you a better fighter. It's not helping you in any way. Um, and as far as training, if I'm a fighter training for a fight, there are so many more useful things than just getting hit in the head. Slipping punches, parrying punches, countering that strike. There, getting just punched in the head is there's so little benefit. I mean, I'm trying to put my mind in these teachers and not assume that they're just trying to do some macho, look what I can do to my students thing, but it's just I mean, maybe if you've got a student who flinches a lot and just really has a hard time having the idea of getting hit, and maybe you just got to show them like, hey, look, it doesn't hurt. It's okay to take a shot. I guess, but the repeated shots, especially with the videos that you put up of just guys sitting there getting hit in the head, is not good for the brain. It's not good for their training, and in the end, it's probably shortening their career, and certainly is not fun. It's not making martial arts enjoyable at all. So there's so many problems with it.
Yeah, and it's something that, I mean, I've seen it so many times over the years. It seems like this persistent myth. And I even had students of mine just ask me, like, oh, what do you mean, coach? Is this a bad idea? Yes, it doesn't toughen up your brain. There's no such thing. It doesn't exist. They're like, really? I'm like, yeah, really? Why do you think we don't do that? And there is something else, though. And I think maybe it comes from, in my opinion, two things. First of all, just antiquated practices when people didn't know any better, and they just think that, well, you get stronger when you lift weights, you get stronger taking punches to the head when you practice that. Um, and things like, for instance, Wolf's Law, which actually works. You do make your bones stronger if you actually put them under pressure, but that doesn't mean it applies to everything. Something like, for instance, soft tissue. Yeah, you can't turn your body into an armor. Yes, you can do, strengthening, toughening, and so on. And there's a lot of stuff that you can do, but a big part of that is actually deadening the nerves. So you just don't feel it anymore. And another part of that is also learning how to take punches with your whole body, as opposed to just the impact is localized and that's where it hurts. But you learn to just move a little bit or absorb it or brace, so everything is more connected, and it doesn't necessarily translate as much into a painful technique to receive. However, there's a huge difference between that kind of training, which Yes, can indeed maybe help you get used to an impact, and getting punched in the head for like, I don't know, 20, 30, 50, whatever punches that. I mean, I've seen really insane, I mean, you've seen them too, these insane videos
Yeah.
where it just keeps going. And it's like, it's enough already, please stop. There's a reason why, in for instance MMA, the ref pulls the guy off when he's doing ground and pound on a guy who stops moving. It's like, we have to stop at a certain point.
Yes. Yes. Brain trauma is not good. As you were kind of alluding to, our bodies have an amazing ability to adapt to a point. But yes, our bones, Wolff's Law, will adapt to the stresses that they see over years. um, our
Yeah.
muscles certainly can adapt a little faster by putting them under stress and trying to lift weights, and it's great. We have these capacities to adapt to the forces that we see. Neurons, nerves, brain cells don't adapt that way. Certainly, you can do things to improve your thinking and create synapses between neurons, but trauma to the brain is doing the exact opposite. Um, so, yes, all for training, all for making your body adapt, but it doesn't work that way for the brain.
Well, I think, I mean, CTE, what they kind of used to call being punch drunk, where you would
Yeah,
see older fighters and boxers, in particular, that they just slurring their speech and having loads of other problems. It as it is my understanding that to this day they can only really find it in an autopsy after you pass away. So we can see these kind of this degeneration. There's videos of professional boxers where you see interviews with them like over a period of like 5, 10, 15 years and so on, and you gradually see how they can't really talk all that well anymore.
yeah,
Gary Goodrich, good example of that. I mean, he had massive brain damage. He fought way too long. He would stand in the ring like, "Come at me, bro," and just take punches. And he's got massive problems. And still to this day, I mean, you don't really see. I don't see it addressed as much as, for instance, it finally happened in American football, where like, gotta wear a helmet. It's still not perfect, obviously, but
yeah.
they stopped denying it. That's one thing. What is your experience working with MMA fighters on that front? Do you see that there's like a change that the fighters and coaches are being more conscious of? Okay, you got to be in it for the long haul. Your career is short, and then there's a life after that. You want to be able to just pull on your own pants and eat your own meals and drink your own beer if you want, as opposed to needing help for everything. Are they conscious
Yeah.
of that nowadays more? Or?
I think there's an awareness, just like all these sports, whether it's American football. I mean, people have noticed, as you were saying, forever. Dementia pugilistica, the older term for this thing that happens to boxers. There's this cognitive decline, and it was correlated, associated with brain trauma over time. And it is becoming identified in American football. They got helmets and pads and all these things. Oh, well, there's lower risk. And no, clearly these athletes are getting it, and it's the repeated brain trauma and all of the things that factor into getting it. We're still trying to figure out. And part of the problem is, yeah, you to make the true diagnosis, you need to take a biopsy of a brain. And that's usually requiring the person to not be alive. Um, uh, but there's growing awareness in all these sports that this is a thing. And the MMA fighters that I know are aware. And I think some have changed their training a little bit, maybe sparring a little less, maybe being a little more careful when they're sparring. But at the same time, these are combat sports with a goal of rendering your opponent unconscious. And so it's impossible to avoid and completely eliminate. But hopefully, guys are realizing that they've got to give their brains and bodies a chance to recover if and when they are getting brain trauma. There are rules as ringside physicians. When there's a knockout, we medically suspend a fighter. We're not allowing them to even spar for a period of time. And there are concussion protocols in all of these sports. So giving the fighters a chance to rest their brains from repeated trauma is a useful thing. but nothing's going to completely eliminate the brain trauma. And how much brain trauma, what kind of brain trauma, we don't know. And it's probably different for individuals. And everything plays a factor. Skull thickness, genetics, the shots that people take, all of it is a factor in eventually going on to having these things. And certainly the longer you go, the more trauma you're taking, the worse off you're going to do. And as you're older, your brain has less ability to heal and recover. So I think another emphasis should be on the aging fighter and taking more time off if you take that shot to the head.
And if we can make the analogy, and I'll just preface that with a little bit of background. I remember about 30 years ago when the UFC started getting a little bit more, traction. It was difficult at first, but eventually it started getting more traction, especially online. There was this kind of reaction back in the day from the BJJ side of like, well, if you grapple, you don't get punched in the head as much, so it is better for your body. In principle, I agree with that. However, it's not like you're immune to injury. So is there, in your opinion, an analogy to, the CTE that we see in combat sports where it's mainly impact, or where impact to the head is involved, and then something analogous when you look at grappling injuries in the long run?
You're making me think of analogies, which has never been a strong point of mine.
Well, I'll give an example. So while you think, I think it was Hickson Gracie last time he was on the Joe Rogan podcast, where he talked about his back being totally messed up and needed surgery. Eddie Bravo, who had a very particular style of BJJ, emphasizing flexibility a tremendous amount. I know he's also had a bunch of surgeries, had, I think, discs replaced in his lower back, if I'm not mistaken. I mean, there's plenty of guys, even active guys, nowadays in the UFC, of like neck fusions and all those kind of things. So, yeah, if you've got a guy who's doing a guillotine on you and he's just putting it every ounce of muscular effort in there, cranking your neck, and then how many times have you had that in training? And you learn to escape from that. Being an arthritis patient myself, I can attest to that. I can imagine where that comes from. So that's kind of just I mean, obviously arthritis would be a candidate, but anything that you would think of?
Yeah, so jiu-jitsu, certainly there's less head trauma, not zero. Certainly falls and throws and the accidental elbow or knee happens. But I agree, overall, jiu-jitsu much, much safer for the brain. But it's still a combat sport. And you are getting your neck cranked on, you're getting other joints cranked on. And so, sure, arthritis, now speaking from personal experience too, my neck's not great. And so you don't eliminate the risk of injury by doing jiu-jitsu as opposed to boxing or kickboxing or MMA. But overall, as far as the importance of our brains, I think that if you're going to choose a combat sport and keeping in mind brain safety, jiu-jitsu is probably better than other ones. But it doesn't eliminate the risk of injury. But I also say, just kind of any sport, any activity, you're not immune from injury. I mean, as an orthopedic surgeon, I'm seeing so many athletes from basketball, or now pickleball is a big thing, at least in the United States, or, driving a car. These are all things that subject us to potential injury. And so I've made peace with the fact that jiu-jitsu, I might get hurt, but I might also get hurt doing just about anything else. And jiu-jitsu, I at least have a little control over what's going on, and I have fun doing it. I get some exercise out of it. I've got friends who are in it. Gives me a pursuit or something else that keeps me motivated to stay in shape overall and eat right and not drink alcohol. And so there's so many other benefits to jiu-jitsu and these other sports that I think that the pros outweigh the cons of injury. But as far as an analogy,
well, Let me put it differently. I mean, over the years, that I've seen a lot of research being done on boxers, brain injuries, and so on. I haven't seen that much research done on, for instance, the long-term effects of training of joint locks, chokes, arm bars, shoulder locks, and so on, for instance, the cartilage, the soft
Yeah.
tissue, the tendons, all these kind of things. Have you seen any of that kind of research?
So we would love it if there was more research. Certainly, because of the newness of MMA and Brazilian Jiu-Jitsu, there's just less time to have researched it at all, and there's just less numbers than, say, boxing or American football or things like that. Now, there are definitely people who are looking into it. I myself and a few other people are could be writing an article for our bigger academy, the American Academy of Orthopedic Surgeons, to hopefully educate on what is out there about injuries. But there's so little about even acute injuries and exactly what happens, that the long-term stuff is, we're far away. Maybe 10 years, 15 years from now, with people like me and my other colleagues who are doing the sport, have interest in the sport and want to follow along and have this data. Um, but it's kind of based on, well, in football this happens, yeah, in wrestling this happens, and we
Yeah.
kind of build some knowledge that way. But combat sports like MMA and jiu-jitsu, we're lacking solid research, and we're hoping to build it soon. But there's not a lot, and I think there are certain things that we are noticing, and maybe it's going to start making its way into research. Uh, there's an interesting thing that happens in the elbow that people are starting to talk about, where it's not necessarily because they had a dislocation, but maybe repeated arm bars for the jiu-jitsu player, or boxing, they snap their punch and their elbow hyperextends a little bit, and they develop this kind of distinct degenerative change of the elbow. And it hasn't necessarily been published in big journals, and and the treatments and how to avoid it and all these other things that we would like to have based on the research doesn't exist yet. Um, but yeah, combat sports not easy on the body, but
No, I will love it.
well, yeah,
um, I'm always hopeful that like the UFC Institute is gonna get, it would be great if there were like dozens of UFC Institute type organizations that do both the dieting, the coaching, the conditioning, and so on, but also the medical side of it, because they have a huge amount of data anyway,
yeah,
working with all those fighters. And from the little that I've seen from the outside, it looks like, I mean, they've got a nice community of scientists and data collection and medical staff, people like you, who are constantly working with athletes. So, and I mean, they keep fight metrics, so that's big data. So
yeah.
I would assume that they also follow, the medical side of it. Do you have any insights on that? If there's some work going on there that you think like, okay, this is actually going to help a lot.
Yeah, so now that I've been working with UFC a little bit in their Brazilian Jiu-Jitsu realm, I've gotten to
That
know
was
the
my
people.
segue into that.
Yeah, yeah, yeah. So UFC BJJ, the UFC is investing in and growing Brazilian Jiu-Jitsu, which is awesome. And I've been fortunate enough to kind of come along and be ringside physician for their events. Um, and now that I've gotten to know some of these people on the inside that you would never probably come across otherwise, they have some amazing people, and they really care about the fighters. They really care about the sport, and there's a curiosity to try to understand the sports better. And they are growing data, and they're building a database, and it's got a lot of cool information, but there's not a lot of long-term data. And
Yeah.
even though the UFC may have hundreds of fighters on their roster and it's been around for 30 years, big picture, that's not a lot of information as far as being able to come up with good treatment plans and preventative stuff. So they're growing it, and they're motivated to have it, and they're going to have the best databases out there. Everything from weight cutting to nutrition to training to body type that makes for a better fighter. They're looking into these things, but it's still growing. But I am excited to be around it and the people who are involved in it. And I think some cool stuff will eventually start coming from it. Yeah, it's going to be interesting to see how it plays out.
All right. Well, and that was my segue into, I mean, you being ringside physician basically at the first BJJ event the UFC held. So two quick questions. First, how did you end up going there in that capacity? And just as a fan and practitioner, what was it like just being there?
Yeah, yeah. It's just a really cool thing to having trained for 25 years in Brazilian Jiu-Jitsu and dedicated a lot of my life to being a physician and orthopedic surgeon, and being able to combine these two things at a really high level was kind of a dream come true. How I got involved was a confluence of many things. Friends I've made over the years who are now very much in the organization, and me having shown that I'm competent as a ringside physician through various capacities as an MMA ringside physician, and me training and understanding the sports. I was invited to be involved and go from there. And then, I guess I've shown a certain level of competence and an ability to communicate with those involved and work with the people who are there. And it's hopefully going to continue to grow. And to be there, it's really cool. The sport of jiu-jitsu, as you probably know, has evolved so much.
Yeah.
When the Gracies first come on the scene and Royce is winning the first UFC to where it's at now as a sport, I mean, the evolution is pretty crazy. And this has happened in 30 years. Part of it is involving other cultures in the sports. Americans had their collegiate wrestling, and Russians have their sambo, and footlocks get added in, and judo is now having this really important influence on the stand-up part. And I wish I was better at it. But these grappling arts that are being brought in from all over the world are being immediately instituted by these high-level guys. If it works, it gets kept. If it doesn't work, it's cast aside. And the sport is changing and evolving, especially also now in the rule sets. And I think one really cool thing is now this pit, having the fighters within this arena where you can't flee the mat. Yeah. And then when there's a takedown going on, they're not necessarily flying off the mat. So you're not having these weird resets that would happen with jiu-jitsu. And as a person who really understands jiu-jitsu and loves watching it, it gets boring sometimes.
Yeah.
But the arena, the pit, has kept the action going. I think having rounds and scoring of those rounds has spurred some action. And then the level of fighter, the athlete who's in it now, is you've got guys who've been training since they were children, and kind of what we see in other countries with soccer, football, there's just this inherent knowledge of the sport that you don't get if you try to pick it up when you're 20 or 25. And it's really cool to see firsthand right there live the speed that they're moving, the techniques that they're able to pull off at such a fast speed. Yeah. With such precision against other really high level guys. It's pretty amazing.
Yeah, I mean, I watched it obviously, and it's like spectacular. And I very much agree with what you just said about the sport evolving. I mean, look at BJJ matches of like 20, 30 years ago, and now it's just and obviously the people back then weren't bad at all. It's just that every sport evolves. The UFC evolved from basically guys brawling with next to no rules to what we have now, just professional combat sport athletes that are fighting at the highest level. Same thing with BJJ, and I was very much impressed with and especially a lot of young guys, like Andrew Tackett, who did really well there. He's not 35, 40, whatever.
Yeah.
It's like this really young guy with exceptional technique and just so fast, explosive. And I mean, there was nobody there who was slow or
No,
lacking technique or
no,
anything.
even the big guys, even the
Yeah,
big guys are moving. And yeah, it's really exciting. The Tackett brothers, the Ruotolos, these are young guys who probably have at least 10 more years of high level elite competition if
yeah,
that's the direction they want to go. It's going to be crazy to see how far the sport's changed in 30 years to where it's going to be in 10 years with these kids leading the way. And with the goal of bringing the sport to a larger audience. I've been able to talk with the Tackets now, and they are, of course, competing for themselves and accolades and winning and all of the stuff that goes along with being an athlete in an individual sport. But I think they also have a picture of the bigger picture, of spreading the sport, making it exciting, and growing it and bring it to a bigger audience. So what the UFC is doing with jiu-jitsu, I think, can be really, really good for the sport.
yeah.
And by bringing in exciting fighters, encouraging exciting fights, I'm really optimistic we're going to see some cool things happen.
Yeah, I think so too. It just keeps getting better. I mean, when you watch it, like you said, it's going at such an incredible speed. I mean, chain wrestling, at just almost doing like a lock flow drill sometimes against an unwilling opponent who's trying to do the same thing to you. Just as you're watching that as a ringside physician, are you thinking like, "Ooh, that is gonna snap that," or one more second and this is gonna happen, and then it doesn't? I mean, are you thinking like that, or what's your thinking as you watch what's
Yeah,
going on?
um, of course, there's the fan in me who's excited to see the action. But as a ringside physician, you do have responsibility, and your highest priority is the fighter safety and
Yeah,
caring for these guys and making sure you're doing what's right for them in the long run. And with MMA, it's a little harder with the brain trauma and other things that go along with MMA. Jiu-jitsu, primarily orthopedic injuries, which as an orthopedic surgeon, that's my realm. And so there's certainly a little less anxiety about what might happen because I know chances are I'm going to be able to handle just about anything that can happen
yeah,
with a jiu-jitsu match, MMA match too, but especially jiu-jitsu. Um, and there are times you get caught up in the action, but then some guy's in a heel hook and he's resisting it, and Mikey Musumeci's gonna start applying some harder pressure, and you kind of like, okay, like, buddy, tap, tap.
yeah, yeah. I saw that. I
Um,
was like, I mean, dude, just you're not winning anything here. These are lifelong injuries. If I mean, because Mikey, if he cranks it up and he just keeps going, I mean, I could just see ligaments staring, and I was like,
yeah,
dude,
yeah. Knee ligaments are important and unforgiving, and if certain ones go, it's a reconstructive surgery, and you're out for a year.
yeah,
And then the balance of, well, if I'm able to get out of this and earn a little bit more money, or at least show that I'm tough and it extends my career because fighters want me in their promotion or promoters want me in their promotion, then there's benefits that all these guys have to weigh. But yeah, there's some times where just tap, just please tap.
Were, were there any injuries? I mean, you don't have to name names or anything, but was there anything that you're like afterwards, after the match was over, that you had to, take care of guys?
Yeah, the big one that a lot of people saw, and I can certainly talk about because it was on TV, was in the UFC BJJ 1. Isaac Doederlein resisted a really tight armbar and did not want to tap, and his elbow dislocated. Um, and clearly that's the end of the match.
Yeah,
And I was fortunate to be able to be there and help him. We had some great medical personnel who could help me, and we got that elbow relocated. And of course, we're going to still send him off to the emergency room to make sure there's nothing else going on with that elbow, like a fracture. And make sure everything is okay. But yeah, that was some action on that first UFC BJJ, and you don't like to see it. You don't want to be
Yeah.
that involved as the ringside physician, and but in the end, happy to be there and help.
Yeah. And I mean, could we use that a case basically to raise some awareness about why you need to tap in time in an armbar? So that's an injury that people can look up if they didn't see it. This is what it looks like, when you dislocate an elbow because you don't tap on an armbar. All right. Could you give some examples of like these are the potential consequences, not for him in specifically, but like you didn't tap, somebody dislocated your elbow. Here's what you might be looking at from like best case to worst case scenario.
Yeah, yeah. So certainly we can talk about that, and the bigger picture will be you're most of us are not professional jiu-jitsu athletes.
Yeah.
We're in there getting exercise and training with friends and learning a sport that is impossible to master, but exciting to be part of. But it does nothing for me as an orthopedic surgeon to get hurt, or the dad who works, as a, engineer with 3 kids. It does nothing for any of us to have a major injury because our ego got in the way. So starting with the elbow dislocation, elbows in general are interesting joints in that they like to get stiff and they stay sore. So even though you can get the joint aligned right away, most people are going to know that elbow's a little different. They may have slightly different range of motion. It might get a little achy if they really push it or the weather changes. Some bad dislocations, or if it turns into an instance of repeated instability where the elbow joint's just unstable, then you got to have surgery and you're out for a while, and then the elbow is especially stiff. A big thing that comes up, and fortunately people are at least aware of the potential injuries, are heel hooks, because of the potential forces that predominantly go through the knee ligaments. And the thing about knee ligaments is there's not a ton of nerves, and so often you don't have pain until it's too late. And with an anterior cruciate ligament or certain posterior lateral corner injuries or the lateral collateral ligament, if they're completely torn, you're looking at a big surgery with a long rehab that, essentially, even for the highest athletes, you're out for a year. So, and then you're at increased risk of getting arthritis in your knee, even if there's a perfect surgical reconstruction. So there's certainly long-term ramifications of having these injuries. And man, it's a bummer if it's your ego that caused it, especially if you're not a professional. So yeah, and then I could keep going down these injuries of things that come up and long-term stuff that can happen. But one, I don't want to scare people. ACL injuries sometimes happen just from jumping, and elbow dislocations can happen just from simply falling. So it's not jiu-jitsu is the enemy. It's the ego. Ego is the enemy often. So.
Well, it's the same thing in soccer. I mean, doing headers on a ball that comes from all the way across the field is like, they over here, young guys, kids can't do it. You're not allowed. And over the years, even the pros are doing it less than before. Why? Because it injures your brain and your neck and so on. And if there's any sport where you see a lot of 40-year-olds that are completely used up, their joints are just gone, especially the knees, it's soccer players. So, and that is supposedly a no contact sport.
Right.
So, I mean, everybody's always looking at combat sports as the big evildoers when it comes to injuries, but obviously they're there. But plenty of other sports have that issue, as you said. The reason I asked is because there's still so much ego out there in gyms and in schools, that especially with sometimes guys who have an ego to begin with anyway, or come with the wrong attitude, or people who don't know any better, and that's the main reason why I asked. So, look, in my MMA class, I teach my guys that, look, we tap early and we tap often. Is that I'm like, you're not toughening anything I mean, if you're hyperextending that elbow, eventually it'll give. And as every new student that comes in, one of the first things we do is I show an armbar and a rear naked choke. And the armbar goes look very, very slowly, and I start doing everything technically more and more correct. So they just get more and more tension, and that arm extends. Now I'm looking. Now I finished setting everything up, and now I'll move my hips. And then I move my hips like an inch or so, and immediately they tap. I said, look, imagine now if I do this, and then I do an explosive bridge. It's like, what do you think would have happened to your elbow? Ah, yes. So you see the light go off. I'm like, please don't ever do that to anybody here. You're not allowed. Nobody can do it to you. You can't do it to anybody else. Same thing with a choke. I'll very slowly put a rear naked on you, and just keep your hand ready to tap. And as soon as you feel it, right? And then obviously they tap, and they feel how the squeeze gets harder. I said, now I'm going to attack you. And then I said, look, imagine if I did this yanking on your neck like that. What would have happened? Well, yeah, don't do that. But still, there's, I mean, I give you an example of Greg Jones that was doing a seminar somewhere in Europe, I think, and the coach said, like, yeah, the guys don't want to teach, no teaching anymore, they want to roll with you. And that, I saw the video, there's his explanation, is that the guy was just dove for my neck and went at it hard, and he just basically hooked him and just snapped it. I was like, that's it, that guy's leg is messed for life now. Like, so ego, it's still a big part of so many people in combat sports, other sports as well, but as in combat sports, you're actually learning how to mess up somebody's body. It's a really bad idea.
Yeah. Ego is an interesting thing. It's there in everything. Surgery, definitely combat sports. Everyone has this ego, and it definitely can be an enemy in combat sports, without a doubt. It's an enemy in most places. And in the beginning, you hope that someone is going to be approaching the sport with humility, and hopefully, if not, their teacher can help educate them like you're describing, making them feel what this is. A slow armbar. Imagine what a fast one feels like. I've found that often people will find humility, or it's going to be pushed on them within combat sports, because there's always someone better than you. And if you're not careful, sometimes it happens with Craig Jones. On that note, I remember seeing that clip, and man, it must be so hard being an elite level guy like Craig Jones, who's famous in the world of Brazilian Jiu-Jitsu, and you're going to get guys with big egos who want to test out Craig Jones or test out whoever the big name and who's teaching the seminar is, and they're going to come at you. And maybe you're jet lagged and you're tired, and maybe it's your sixth roll in a row, and now you got this young guy who's going after you hard. Yeah. And it's a combat sport, and you got to take care of yourself. And so obviously snapping a guy's knee, not ideal. I would hope Craig Jones would say maybe that wasn't what I was aiming for, but at the same time, I have to take care of myself, and this guy was coming after me, and I'm one of the best guys in the world, and sometimes things are going to happen. And this is something that's kind of been implied, and you were talking about it with teaching, but especially as students, there's kind of this mutual agreement between two students where I'm going to take care of you, you got to take care of me. And that could be, if I get a takedown, I'm putting you up in the air. I'm not just throwing you to the ground. Hey, I get an armbar and I'm slick and I got it tight. I'm not popping it. I'm giving you a chance to recognize, I'm caught. And that is a lot of being a student, and a lot of being a good student and a good training partner that some people need to learn. Some people intuitively get it. But it goes with, if you're going to go after Craig Jones hard,
that's a bad idea.
You got to realize that he's really good too. And you have to accept the consequences. If you're not going to look out for him, he may not look out for you.
Well, I like what you said about, the mutual understanding. What I tell my guys in my class, especially, everybody who comes in first time gets a speech, the explanation. And we have our rules online on the websites, like these are the guidelines for training with us. And one of the key points is that you are responsible for your techniques, not the other guy. If you start cranking it up, that's you doing that. If you do, a throw way too hard when we're just, drilling or we're just learning, that's on you. Same thing with a choke, with a lock, with a punch, kick, whatever. If I say don't do that, for instance, I don't let my guys do hard calf kicks. Why? Because I actually broke somebody's fibula once doing a calf kick. I'm like, it's hard to control. I can see so many ways in this can end wrong. Can't do it. No spinning elbows. When we spar, you don't do a spinning elbow. Why? Because A, we're amateurs. B, we are a recreational MMA club, so we're not teaching. I no longer teach competitors. And C, it's like you just learn this. There's no way you can control it. There's just no way. And
Yeah.
especially as there's no protection there, and even if you put protection on, like some of the pros do, I mean, there's just no way you can make sure that this doesn't lead into an injury. So you can't do it. And even if you want to, okay, there's a heavy bag over there. Have some fun with that. That's going to be awesome, and you can do that there, but not with your training partner. He has to go, like you said, he has to go to work tomorrow. He's got 3 kids that he needs to support. So anyway, I'm ranting. I'm sorry, but
No.
it's just so common.
Yeah, it really is. And it's an interesting thing. Certainly when I was starting to do jujitsu 25 years ago, the guys in it are young guys who are athletic and full of ego and testosterone, and there was an environment around them. But as the sport has grown and as we've gotten older and we're able to teach the next generation, hopefully we're also going to kind of show them longevity, what it can be to be in these
Yeah,
sports when you're 50, 60, 70 years old, not just focused on performance when you're 20. So a lot of it is teaching them lessons like that and imposing some sort of rules. And as long as they understand those rules and why they exist, then I think a lot of students are going to kind of like, okay, that clicks with me.
yeah,
And if they're acting in the benefit of their training partners, I think overall the gyms and everything is going to be that much more safe. If everyone's like, hey, I'm looking out for this guy because he's looking out for me, we're going to help each other get better at these sports and grow together, then you're going to have a good school and guys are going to learn fast and you're going to have some really good guys who aren't getting hurt. So,
yeah. Totally agree. Um, I want to switch a little bit to, basically uh, abusing you a little bit because of all your knowledge and experience, and asking. This is the question I get most often asked by people when I have a guest on who's a medical expert, just as an orthopedic surgeon in general, but also in particular with your specialty of hand surgery. Could you give some advice? Like, what are the biggest mistakes you see martial artists, combat sport athletes, and practitioners do?
um, so because injuries are a completely unavoidable part of this, and if everyone's doing what the right things are, you're training to look out for your partner, they're looking out for you, still injuries can happen. And I think the biggest thing that anyone can do in a broader picture is give their bodies a chance to recover. Uh, when you're 20, sure, you can push through things and you recover faster. What might only hurt a couple days starts taking longer as you get into your 40s. And giving your body a chance to recover from the little nicks and scratches is crucial to avoiding a more serious injury that goes from a little thing that can be managed to now you need surgery.
Yeah,
And that is for just about any body part. But just got to say, give your body a chance to recover. And I'm not saying don't train. It's pretty rare that I tell someone, one of my patients, like, oh, just stop training. In fact, I don't think those words have ever come out of my mouth. But it's figuring out ways to protect your injury, but still get stuff. Uh, and so maybe you got your elbow popped. Okay, keep the elbow moving, but you're not getting a situation of live sparring where you might fall on the elbow or you get armbarred. But hey, go drill those guard passes. Go after it. You can modify the way you're training to protect your injury. Um, So recovery, I guess, is probably the biggest thing that I'm going to tell anyone. Um, as a hand surgeon and person who needs to really take care of my hands, I wear these little gloves, buddy taping gloves. They put my fingers together, and no one finger can really kind of get independent of the others and get twisted or pulled. And it definitely reduces the risk of injury to my hands. And as long as I'm wearing them, I'm not too worried about a bad finger injury. I personally have also stopped wearing the gi. It was just too unpredictable on my fingers, and I would stop using the gi for my advantage, a grip, and then guy goes to break it, and I'm just letting go. And then I'm not using the gi, and then they're using the gi, and then they have an advantage, and it just wasn't as fun. So I've stopped using the gi, and I'm careful with my fingers, and I'm a big fan of the buddy taping as a way of protecting the fingers. Another preventative thing, warm up. And it's yes, it's getting your muscles and your joints and your tendons to get literally warm and moving. But there's a big thing of getting your brain and body connected, whether it's the proprioception or just the mental shift that needs to take place as you go from, hey, I just worked a 9 to 5, and now I'm going into this class, and I got to get my body ready to move. So whatever that dynamic warm-up looks like to you, and sometimes it takes practice what that might be, but I often am going through a process. I start with kind of rolling my back out, kind of assessing how things feel and if I'm going to need to protect something that day, getting the back loose, and then I kind of do a light jog as I feel my hips and knees loosen up. Then I'm doing some side movements. Then I start doing some high knees, a little more dynamic movement. And then I'll be doing things where I'm seated and moving to a full standing position to kind of really get those knees and hips where they need to move. And then as I've done this process, maybe it takes 5 minutes, I've kind of felt how my body's feeling that day. And if I need to give a little extra attention to something, maybe, I need to get my muscles going. Let's do some burpees. Oh, hey, my shoulder's kind of hurting. All right, we're going to do some air squats, things like that. So the brain-body connection, getting your body ready for a dynamic sport, I think, is very helpful for reducing injuries.
Yep. All right, that's excellent. And then the other side of that, any best practices? I mean, you just mentioned obviously warming up, but like tips for BJJ and MMA practitioners, like as opposed to avoid this, in particular, do this, make sure you do this outside of just warming up.
Good things to do. Tap early, tap often. Get rid of that ego. Other things to add to the game, I would say work on having a fundamental understanding of techniques. This is, for example, the heel hook and what could happen with it. And I'm of the belief that it's okay to show heel hooks to beginners, mainly so they have an understanding of what it feels like and how bad things can happen pretty quickly. And then they'll tap early and often if they're stuck in it, and hopefully understand if they're looking out for their partner to not go crazy with it. So education and a fundamental understanding of what these techniques can do, I think, is a crucial part as coaches and teachers, but also as a student. You're like, oh, that looks cool, let's do it. No, that's not how you apply technique. It's a fundamental understanding of what you're doing and how it's applied is crucial.
Yeah, no, that's excellent advice. And before we switch to the second part on Patreon, what's your training like now?
I was recently talking to someone about this, and it's been a recent switch. I've dealt with some injuries recently. My neck kind of got a little messed up, and it was more than the young guy, it's a little tweaked, I'll be fine in a couple days. It was something that has lingered and has set in with me, like I need to be more careful. And I had a style that was kind of a wrestling jiu-jitsu hybrid where I liked to play with the guard, but a lot of my reversal of positions was wrestling up. And I know people might go for the guillotine, whatever. I can get out of it because I know that's what they're going to go to. But sometimes there's a guy who's really strong and I don't get out of it as fast as I would have liked. Or even as I'm getting out of it, maybe I'm not getting choked, but the neck gets a little tweaked. So I've started to realize I've got to make some modifications into my style and avoidance of things. And while I preach lacking ego, I had an ego still. And some of it's telling a guy like, look, you get a hold of my neck, I'm going to tap quick.
Yeah.
Just, I want you to be able to work the technique, but I got to be careful of my neck. And so if you get something, just know I'm probably going to tap quick. And maybe they're going to be going after it. And okay, maybe that's not a great training partner, but maybe they'll realize, all right, well, maybe I'll work on my footlocks today.
Yeah.
And that's what you hope for in a good training partner. But I'm certainly going to be working hard. I want my heart rate high. I just have a preference for a more dynamic style of jiu-jitsu. Maybe that might change as a dynamic movement does subject you to potential injury. But I like moving. And if you got someone who's higher level and also wants to flow, then you can make some really cool situations happen. But there's that beginner who isn't going to know the understanding of flow. And if you give them space, a stray elbow or something weird might happen. And so I will now more often than not just kind of, make it clear.
Yeah.
I've been doing this a long time. If you go hard, I get to go hard too. But also not give them the freedom to do something stupid. I'll be more focused on positional situations and not letting the elbow get free to hit me in the eye accidentally.
That reminds me, a friend of mine, Barry Eisler, got his judo black belt at the Kodokan in Tokyo. And he mentioned talking to this older judoka, and the young guys were going at it with him and couldn't throw him. And then afterwards he asked him, like, okay, so how the hell do you do that? And he's like, well, I'm not as fast as I used to be, maybe, but, he's been training for a long time, obviously has loads of experience. And I said, I could see that they're going to do this throw, so I just reposition myself a little bit so they can't do it. And then they try the next one and do the same thing. And eventually they just get frustrated and they make a mistake and then I trip them.
Yeah.
Something along those lines. And I've noticed myself as well, just I'm too old for that. I mean, I used to do like jump spinning back kicks, all that fancy stuff, and now I'll just pop a jab. That's
certainly
good
as
too.
you age and you realize your speed isn't what it used to be and your recovery time isn't what it used to be, and hopefully your ego is getting a little less. Yeah, the flashy stuff is less important and effectiveness is important, but what that effective looks like is understanding the situation and prevention and an old guy jiu-jitsu where, look, all right, I'm not going to go like this with the 20-year-old wrestler. I'm going to give him something that I know I'm going to escape. And then I haven't fought his body in a way. I've created a situation where there's going to be some movement and I'm free to do what I need to do. And we're okay.
Yeah.
Yeah.
My son told me a while ago, it's like, hey Dad, there's something for you on BJJ Fanatics. There was a video was on sale of like old guy jits. I was like, thank you, my boy. And it was good. It was, really good stuff. All just like, okay, you don't need to be the strongest or most explosive guy to do this kind of technique. It's more focused on the aging practitioner who doesn't want to, like you said, be able to just, I'll get in a guillotine, but I'll get out of it. It'll be okay.
Right.
We all get old.
Yeah. It's hard to realize we are getting older, but It's important to realize.
I agree.
And there's a freedom that comes with understanding the limitations and also understanding, look, I'm in this because I hope to be doing it when I'm 80.
Yeah.
And if I'm doing stupid stuff now, that's not going to be a possibility. So reframing the goals, I want to be in this for a long time. I'm not going to be a world champion or looking to be a world champion. So it makes some decisions a lot easier to make. And that could be tapping early and often.
Just a final question before we get to the bonus part. Anything new coming up on your end? Anything that you're working on that people should know or be looking out for?
Yeah, I got a few things. hopefully you're not seeing me much at the UFC BJJ events, but there's another one coming up at the very beginning of October. I'll be
Nice.
ringside for that, and if you're seeing me, it's because less than ideal things have happened. Um, but I've got some stuff out there on social media and YouTube, and I try to combine combat sports and doctoring, and I think some people find it helpful. And then I'm working on a book.
Nice,
Kind
nice.
of the realization of I've got some lessons I think I can teach, and it's probably helpful for me to solidify those lessons learned through surgery and fighting and life. So I've got a good rough draft now. I'm hoping to get this out by the end of the year. We'll see. Writing is a new and interesting thing for me, and that's part of the reason why I did it. I've always told myself I was a bad writer, and so let's lean into that and one, get better at it, and two, prove to myself that I can be all right.
It's great. I mean, I was lucky with my writing. I had a mentor, Lauren Christensen, who has tons of experience and is a really great writer. But my writing was really crap at first. He recognized
That's
something, I
anything.
think, but exactly. But I mean, let me know when it comes out. I'll give it a plug and let everybody know. And I mean, your social media is really good. I really like it a lot. The both Instagram is a lot of fun, but also the YouTube channel is a little bit more in depth than on certain things. So I would very much recommend everybody listening to check out and subscribe to Dr. Luke's socials. It's very much. I mean, I've been doing this for a long time as well. Made a lot of stupid mistakes. Paying the price for it now. Getting older is gonna suck a lot more for me than for the average person. I do what I can to mitigate the results, but there were so many things that if I had that you mentioned, had I known that I probably could have avoided. So, and this is true for all practitioners of martial arts, combat sports, what have you. Even if it's just as an enthusiast, it doesn't have to be professional. Like you said, injuries are just a matter of time if you do combat sports. It's gonna happen. You can just trip and fall on the mat and injure your ankle. It doesn't have to be something spectacular, but there's things you can do to help prevent that, and also how you manage that once it happens. Could you give a quick shout out to yourself? Like, okay, where can people reach you?
The Instagram dr underscore Luke LUK or LUC. Actually, no, there's no underscore anymore. DRLUC Dr. Luke MD is the now social media Instagram handle. And then Cut to the Bone is the YouTube channel. I'll have my own website here in a little bit, and then there'll be advertising for the book if and when it's ready. But yeah, I love having these conversations with you, and I do want to say I really appreciate what you're putting out there on Instagram. Um, it goes along with education and prevention, and people just don't understand the possibilities that can happen with physical altercations,
Yeah.
and perhaps we're painted an image is painted with movies or how things are portrayed out there, or we see things with highly trained athletes and it looks easy. But man, out there in the real world, physical altercations can be exceedingly dangerous and should be avoided at all costs. So I really appreciate the things you put out there too.
Yeah, my Instagram changed over the years, and now it's for large part just I put up videos. I share videos, remix videos of other accounts where you see typically some sort of stupid training guy headbutting something for I don't know X number of times, a plank of wood that definitely won't break, or a tree, and then all these kind of street fight situations. I try to give like a quick takeaway, and every now and then a little bit more in depth, depending on how much Instagram allows me to put on there. It's always an issue, but it's just like you said, people like, do you have an idea of just how dangerous it is what you just did, or how horribly wrong this could go, or what you just did to that person? He's gonna sue your ass off because I can hear that dry crack of somebody hitting the back of his head after he gets knocked out on the concrete or on the pavement. Yeah, I mean, and you know full well what kind of injuries can result from that. good luck if he's in a coma for weeks or months on end, or he'll never walks again, or can't dress himself anymore because of that punch that you did, because he bumped into your shoulder and you couldn't let it go. I mean, anyway, I'm gonna go off on a rant. I'm not gonna do that.
No.
Folks, check out Dr. Luke's socials. I will put links to that in the show notes. We're going to head on over to my Patreon, where he is going to answer a bunch of fun questions from my patrons. That's always a really fun part, because they think out of the box, and it's always a good time. So you can check that out there. And obviously that's one of the ways that you can join, you can support my work. There's a free membership as well. There's some stuff there. I just put something on there today. And on the other memberships start at $3 a month. That's not even a coffee anymore nowadays. So I think that's very reasonable price-wise. All right, Definitely. Dr. Luke, thanks again. And folks, we're out of here.
Thank you.